90s, most of the countries improved 10 and 20, but still we are facing this problem. So this study will give some insight about the campaigns and repeated campaigns and drives to eradicate polio from Pakistan year after year. Next, please. I will show you that what was the objective of my study. The objective of my study was to know the factors as well as to second slide objective. Yes, next. So to evaluate the polio eradication. Next objective. Yes, to evaluate polio eradication immunization campaign and to list factors obstructing success of polio eradication and to suggest improvement in polio campaign at community level. That was the main objective, and we have done this study in February 20th as well as in the May campaign. So we completed or covered 2 campaigns, and duration of the study was from 14th February to 20th February, and then again in the next campaign. And micro plan and vaccination carriers and interview of polio workers was used in the methodology. The sample size was 135 children from 400 houses, and all the children were under 5, and this was a convenient sampling. And inclusion criteria was all children under 5 years were included, and above that age were excluded. Next, please. So this table shows that gender of the children. You can find that the females were more compared to the male, and 48% were male and 51% female. So this is against the ratio of male-female in Pakistan, where male are more and females are less. But here in the campaign, we have seen that the ratio of the female children is improving, and I think that is a shift in the demographic which is reflected even in the polio campaign of our sample. Next, please. Patient education was an important factor, considered that the illiterate people might be there, but because this was a university, this village is just next to my university, and even where I am presenting this paper, only a walking distance away from one of the best university of Pakistan, Israel University. So this shows that the education is either costly or still not the priority. So the same is reflected in the vaccine campaign. Next, please. This shows that the morning time campaign is more effective, and of the coverage of the children are
source the polio vaccines.
Our vaccine quality is a WHO certified quality. It was oral polio vaccine which were used in these campaigns, but in some campaigns we used the injectables also. But in this study, it was the oral polio vaccine which was there with the polio teams, and it was good quality as well as cold chain was maintained very well.
Okay, thank you, Prof, for the presentation and answering the question. We will move on to Dr. Chowdhury Mohammad Nabi Kabir from the Department of Faculty and Emergency, Government of Bangladesh. And his presentation will be on the genetic influence of urinary tract infection, its progression and prevention of chronic kidney disease.
represented that.
And I think that 40 to 45.2 rural women were obese and due to excess of nutrition or dietary substances in rural area. What was the reason that excess has increased to the rural area? Whether it is the wealth, it is marketing and media influence, or it is urbanization. Satna, you can repeat my question.
Sorry, I'm also unable to hear your question.
Can I again repeat? Can I repeat? Sapna, I can repeat.
Yes, you can repeat, Prof. But
Thank you. My simple question is your research showed 45% rural people were obese and due to excess dietary or food availability. Why this was more excess? It is due to the wealth, it is due to the marketing strategy, or it is the urbanization factor.
Okay, so I'll just try to what I understood. He's trying to ask you, like, in your findings, you said 5% of the rural population is becoming obese due to the fast food availability. So, is it the change in the dietary practice or it's the urbanization? So, is that question correct?